Atrial fibrillation is a condition that affects many people, and the way I'd like to think about it is that the heart itself is both functions electrically and mechanically as a pump, and when you have a condition like atrial fibrillation, the electrical signal is aberrant or chaotic, and that translates into poor mechanical function.
A little over 2 years ago, I felt very tired and had no energy. My wife, who's an RN, checked my pulse and she said, "You probably have an irregular heartbeat or atrial fibrillation." And sure enough, when I went to the doctor's appointment, checked my heart, and they immediately called for an EKG. And when I had the EKG and he looked at it, he sent me to the ER.
John Corcoran's type of atrial fibrillation was of a type that was suitable to a procedure that I've been performing, known as the convergent hybrid, which is a procedure in which we deliver energy both on the inside and the outside of the heart for the treatment of atrial fibrillation. In the New England area, where the Cardiovascular Institute was the first to pioneer this type of approach, and I am the most experienced operator in the New England area. I've been doing it for about half a decade at this point.
I just felt that it was serendipitous that I happened to be the best candidate when Dr. Chu came on board, and that the other doctors were aware of him and they knew that I possibly could be cured by his procedure.
Our outcomes for folks like John and his type of atrial fibrillation have been excellent.
It sounded like this was something that I would be a good candidate for and that I really wanted to do. So I made a deal with him that I wanted to be the first in line.
We are one of the few centers in the country that have what's known as a hybrid OR to perform these types of procedures, and the approach that we have for treatment of atrial fibrillation, this convergent approach, is really a collaboration between the physicians in the Cardiovascular Institute and the fact that we have state-of-the-art facilities like the hybrid OR where we're able to treat patients like John very effectively.
I have a small little scar that you can hardly see, and I was back to beating regularly and left the hospital within 2 days.
The EKG looks fantastic. Yeah,
okay,
looks really good. Yeah. John is doing fantastic. Following his surgical approach with the convergent hybrid, we've been able to get him off all of his medications, and he's been able to maintain a drug-free regimen for his atrial fibrillation, meaning he's in normal sinus rhythm without any recurrence.
I'm not on any of the meds anymore, and you know, life is good.
Previously, he was really not able to do many of the things that he enjoys doing now, which includes coaching his local high school football team and really being as active as he's accustomed to being.
I feel that my atrial fibrillation has been completely cured. I'm looking forward to living my life out without ever having atrial fibrillation again. My heart is happy, and I am happy.